Now, next up, looks, we've had two presentations already now, and they're both our home and our health and everything like that. So I'm sure there are questions. If there are questions from the room, you can again just keep them, and we'll get to you in a minute. If you want to put them on Slido, please do. And if you want to tweet out, again, don't forget you can tweet out using the hashtag. I'll give it a hashtag. It's hashtag EHWC 2022. Okay. All right, now, so next up we have Jean, Dr. Jean O'Dwyer, and Jean is Deputy Head of Environmental Science at University College Cork and the Deputy Director of the Science Foundation Ireland Centre for Research and Applied Geosciences. So she's an expert in environmental health sciences with a focus on water quality and waterborne diseases, as well as the impact of climate change on human health and well-being. And Jean is going to be talking to us about VTech in private wells. Okay.
Thanks, Michal, and afternoon, everyone. So next up on Ways Your Home Can Kill You, we're going to be talking about water and not air. Right? It's not all as bad as it seems. So we're going to be talking about a very specific problem, and that is a bacteria called VTech in private wells, which is, I suppose, a rural problem in Ireland. So potentially an oddly specific problem, but it's quite a substantial one. And from my perspective in the environmental health sphere, it's a very kind of obvious example of an environmental health issue, where we have done something where we've deteriorated the natural environment, and we can see very direct health outcomes associated with that. Right? So there's a lot less nuance with this specific issue as opposed to some of the other ones, and I'll talk you through it. Right, so an introduction for those who potentially don't know, because realistically, if this never impacted you, you might know about it, which I hope is the case. VTech, as I said already, is a pathogen. So it is a pathogenic strain of E. coli. So most of us are familiar with E. coli. E. coli is in every single one of us in this room, but the E. coli that's in all of our guts generally isn't pathogenic, it's commensal, but there are pathogenic strains of it, and VTech is one of them. So it is a notifiable infection, like things like COVID or meningitis. So if you do get a VTech infection, somebody in the HSE knows about it, and you get added to a list. And that's great because then we can do epidemiology to kind of identify some of the risk factors associated with it, etc. So there's loads of different strains in it. You don't have to worry about that. In Ireland, the main ones are 0157, 026, a couple of others. And we have been monitoring the prevalence of this disease since 2004 when it's been mandated. Ireland has the highest incidence rate of VTech in the EU, right? It's one of the few things we lead on in Europe, is the infection rate of this disease, which is up to 8 times higher than the EU average, right? So it's not like we're marginally better at this infection, we're a lot better. So we have a very high crude incidence rate, which is extremely problematic. And it's not like this is a once-off, this is continuous. Year upon year, we have the highest rates of this. And if we take that data of all these infectious disease cases and we map them and we look at the enhanced surveillance data, which we have done in the past, a few years ago we published a paper, and what we found was people who use a private domestic well are almost 19 times more likely to contract this disease. Right, so there's very clear association epidemiologically between the use of groundwater or private wells and VTech infections. So sitting here in the lovely Radisson Blue in Dublin, we don't really think about groundwater as such because we're served by the public supply by Irish Water and in all urban areas. But if you're not in an urban area, you generally are reliant on a private domestic well. And we actually have quite a lot of them. So the last census showed that about 750,000 people were reliant on groundwater as their daily drinking water supply in Ireland, which is a substantial amount of people. Okay, the best part of a quarter or a fifth of the country. And this is managed through 120,000 or so private wells. We actually don't know how many wells there are in the country because one of the biggest issues is that they're unregulated. So if you're familiar with drinking water, and Joe, if we're drinking water here at lunch, we're not thinking about it. We know that it's treated. We know that it's governed by EU legislation. But there's a little asterisk in the EU Drinking Water Directive that says if the water supply serves less than 50 people, it's not covered by the EU Drinking Water Directive. So unless you've been very busy and have a lot of children, your private water supply is not covered by this legislation. So the quality of that water is completely up to yourself, right? So it's not the EPA's responsibility, it's not the local authorities, it's the private well owner, right? And this comes obviously with its challenges, because groundwater supplies, even though groundwater is absolutely better quality than surface water because it's protected, it still can get contaminated. And if we think about rural Ireland, we have septic tanks, we have agriculture, and then we have this private drinking water source, that can be this source transport receptor model of infection. And that's what we're seeing. So if we talk about groundwater quality, so the EPA obviously has a monitoring network for most things, and groundwater is one of them. So we took the EPA groundwater monitoring data sets and we plucked out those that were pertaining to drinking water, and we looked at it over a 10-year period to see what was the quality of the water, right? And what we found was quite, I suppose, stark really, was that almost 70% of those groundwater supplies had E. coli in them at least once over the 10-year sampling regime. Okay, so that's almost 70% of the groundwaters contaminated with this fecal bacterium in the actual groundwater itself, right? So it was extremely, extremely high. Okay, now these are monitoring wells, they're not the domestic wells, but it just gives an indication of groundwater quality and the issues we potentially have. Right, so now we had this epidemiological link, where if we look at disease data, we see a link with private well usage. If we look at the environment, we see the reduced quality of groundwater in Ireland. So as researchers then, and Dervla, my colleague, is in the audience as well, in NUIG, or University College Galway now, we looked to see if we could actually detect VTEC in private wells. So we went out last year looking for VTEC, and what we found was that we found VTEC genes in 10 of the 52 wells. So this is the first time that we could kind of quantitatively say that we have VTEC in private water supplies detectable. And these are people's homes. So these are people that are drinking this water on a day-to-day basis. What was interesting, because testing for VTEC is expensive, we're not going to routinely do that all the time. Testing for E. coli, which is generic, is cheap. And what we found was a ratio between generic to pathogenic E. coli of about 40%. So that means if we find E. coli in a groundwater supply, there's about a 40% chance that that will be VTEC, which is obviously a pathogen and can make people very sick. So we were able to detect the serogroups that we see in the infection data. So we had this very kind of evidence-based conclusion here now that there's an issue with groundwater as it pertains to waterborne diseases. We looked at risk factors because there's absolutely no point in going around telling everyone everything's broken without figuring out a way of how we fix it. So we looked at some of the things that drive it. And it's the usual kind of chestnut, or the old kind of songs anyway, that we know that where groundwater is more vulnerable, that there's less protection, that maybe karst areas and things like that, there was a much higher risk of having E. coli, and therefore VTEC. We found associations with septic tanks and agriculture. So we have these two sources of fecal pollution in rural Ireland, both of which are playing a role in groundwater contamination. We found things like well depth had an inverse relationship. So the deeper the well, the less likely you are to have E. coli contamination. And then we saw things like rainfall. And whenever I see things like rainfall or temperature, you immediately think of climate change. And will this change as our climate changes? So just an overview of findings, I suppose, what this means in numbers. If we take the supplies we have about 120,000 private wells in Ireland, and that's an underestimation, I would say. The only way we can tell is through the census. Realistically, what we're saying is about 81,000 of those will have E. coli at some point, potentially, if we look at the overall groundwater quality. If we apply our generic to pathogenic ratio, we can say that over 30,000 of those potentially have VTEC genes at any given time and are thus a very, I suppose, direct source of waterborne diseases. And we can calculate that the crude incidence rate of this infection for private well owners is inordinately higher than, I suppose, the national average. So again, that we have this very key demographic who are at risk of contracting this infection. This clock is very foreboding. Right? So looking at the conclusions and the recommendations, so I think one of the most tangible things we can take away is there's definitely an association with well design and this issue. Okay, now to this it's very important. There's an environmental issue here that the groundwater is getting contaminated, and there's a public health issue that people can potentially get sick, right? We can't, or in my opinion anyway, it's very hard to tackle the environmental problem because septic tanks, you know, with so many of them, agriculture, how do we even do that? I'm not sure. So it's hard to deal with the environmental problem. I'm sure we'll get there eventually, but maybe not today or tomorrow. But we can certainly solve the public health problem because we can put in barriers to prevent illness from happening. And one of the things is we need to establish very stringent guidelines for well design and how we bore them and how we maintain them. So, I mean, a lot of wells are inherited. People buy a house that came with a well and they know nothing about it, right? So we need to have this kind of system in place like they do in the United States or in the UK, where this is regulated, just like we do for septic tanks now. We need to communicate with private well owners, right? So I have talked to hundreds and potentially thousands of private well owners, and they know it's their responsibility. They're not looking for, I suppose, for the EPA or the HSE to save them, but immediately when they know that there's an issue, they want to fix it. And most people are very proactive in solving the problem themselves, putting in treatment systems. So personally, I think like radon, or like carbon monoxide many years ago, there should be an information campaign that's, I suppose, a bit more ubiquitous than a page on the EPA website, that people are aware of this. Because, Joe, if you didn't know, why would you even think about it? So I think that's really important, and put the onus on people. I think that where places are very high risk, and these are places that are routinely kind of contaminated, there should be an effort, perhaps by Irish Water, don't want to put them on the spot, to try consolidate houses into group schemes that could be more easily managed in terms of treatment. And then, Joe, agriculture and septic tanks are a key source of problems in rural Ireland in general, right? And we really need to come up with ways to try tackle this. I'm not the person to do that, right? This is going to take a lot of people thinking together and, you know, trying not to play the blame game and having kind of sensible solutions. But at some point, as Laura was saying this morning, we have to tackle the issue of agriculture and water quality in rural Ireland. And then lastly, then, this is something that's impacted by meteorology. So we need to start asking the question now, is this something that climate change will have an impact on? So I think that our climate change policies should have a very distinct focus on water and health and how climate is integrated into all those things. So that's it in a nutshell. So I hope you learned something. If any questions, you can chat to me afterwards, or my email address is there and I'm happy to take any questions. Thanks, Neil. Oh.